Good morning. Thank you so much for joining us for Coffee Conversations this morning. We are so excited to have Dr. Khoury with us to talk about breast oncology, such a huge part of breast cancer in general. So really cool to have the expert here to tell us all about it. So Dr. Khoury, could you please tell us about yourself, your profession, and all of those things that you do in the breast cancer community?
Absolutely. I'm Katia Khoury. I'm a breast medical oncologist. So I trained in hematology and oncology, but I specialize in breast. Been doing, breast cancer for the past, almost 7 years. And I joined UAB about 3 years ago on faculty as part of the breast team. So I work a lot with the breast medical oncologists, the breast surgeons, and the breast radiation oncologists as well.
Well, thank you so much. And it's a pleasure to have you in Birmingham. We want to get more into breast oncology. So can you just break that down for us in just ways that we can all understand? What is breast oncology? What does it mean?
Absolutely. So breast oncology is really treatment of breast cancer, and that is a very multidisciplinary way of treating breast cancer. So as I kind of said before, I work with a big team at UAB, and I would say that's kind of similar everywhere when we're treating breast cancer, because it is a very multidisciplinary way of treating it. It involves surgery, it can involve radiation as well, and it involves systemic treatment or treatment that goes through the whole body. And my role as a medical oncologist is really medications. And so when we think about breast cancer, there are several stages of breast cancer, and we'll go through that. But for early stage breast cancer, usually the treatment is more multidisciplinary. Typically, there is a cancer that forms in either breast, and you want to remove it surgically. Everything really you do before or after in terms of treatment with systemic treatment or with radiation is to help decrease the risk of recurrence. When we are dealing with more advanced breast cancer or breast cancer that is stage 4 or non-curable breast cancer, usually the mainstay of treatment is systemic treatment. So it's treatment that goes through the whole body to treat the breast cancer everywhere. And there may be a role for the more local treatments like surgery or radiation, and that's more palliative in that sense. So we can go through that in detail, sort of as you want to, if you want to ask more questions about that, and I'm happy to
Yeah,
go
I
through that.
actually do. Because I mean, a lot of times, I know when I was growing up and I heard breast cancer, I didn't know there were different types of breast cancer. I didn't know there were different stages of breast cancer. And it's so important to know, what stage a person is because it can have a lot to do with their treatment. So if you could, I know you touched on it a little bit, but can you just kind of break down the different stages of breast cancer, what they are, and, what classifies a person as stage 0 or stage 1 and so forth?
Absolutely. So let me start off by saying not every cancer is the same. And so when we think about cancer, there are so many different types of cancers. Cancers can happen in different organs. So when we're talking about breast cancer, it is cancer that develops in the breast. So the breast is not a very complicated organ. It is made of ducts and lobules. The ducts are, well, the lobules are the ones that make the breast milk, and the ducts are those that carry those from the lobules to the nipple. And so it's really a very simple organ when it comes to that. And breast cancer can develop in the ducts or the lobules. So if you hear about something called invasive ductal carcinoma, carcinoma meaning cancer, ductal meaning it started in the duct of the breast, invasive lobular carcinoma is basically still breast cancer, but where the breast cancer happened is in the lobule instead of the duct. So they're both breast cancer. It's just two different ways of saying where this started from. Breast cancer is in its own it has its own world, because just like not every cancer is different, not every is the same, not every breast cancer is the same either. So when we think about breast cancer, we usually think of 3 things in order to classify it. And these are estrogen, progesterone, and HER2. Estrogen and progesterone are our female hormones. And HER2 is a protein that some breast can overexpress. We call it HER2 positive breast cancer. The reason why we make that differentiation is because there are different ways of treating cancer. The prognosis is a little different as well. What we know about the breast cancer is a little different as well in terms of how the natural history of it is. And that's why we treat them very differently. So there are many different types of breast cancer. The first one I would say is, or the most common one, is one that could be estrogen or estrogen and progesterone positive and HER2 negative. That is what we call a hormone-driven breast cancer. The second one is one that could be HER2 positive. So it could be either estrogen positive and HER2 positive, or it could be estrogen negative and HER2 positive. And then the third one is called triple negative breast cancer, when all three of these are not overexpressed in the cancer. So the cancer is not motivated by either your female hormones or that HER2 protein. And that's what we call a triple negative breast cancer. So these are the different subtypes of breast cancer, the way we think about them today. Of course, it is can be a little bit more complex in a way, but at least for, the way we think about breast cancer nowadays and the ways that our treatments are tailored, this is how we think about it. Now, stage and grade can be a little confusing as well.
Okay, yes, please. Break that down for us, because I didn't know that there was I always thought of just stages, this is stage, whatever. I didn't know that there was, an entirely different category of grades. So if you could just kind of break that down for us, that'd be really awesome.
Of course. So we talked about the subtypes, different subtypes, but each subtype can be a specific grade and can be a specific stage. So when we think about a grade of the cancer, it really is, it'll show up on the pathology report. If someone has a biopsy and it shows breast cancer, a grade can be anywhere between 1 to 3. Grade really means how the cells look under the microscope. It's anywhere again between 1, which is a low grade, 2, which is an intermediate grade, and 3, which is a high grade. Basically, what it's telling you is how proliferative those cells are. What cancer is basically cells that have sort of lost their brakes and are just proliferating or dividing quickly. And so when we think about grade, it's really when the pathologist is looking under the microscope at those cells, they grade it as a low grade, that is kind of a more slower growing cancer, and a high grade, which can be a more sort of proliferative breast cancer. So grade has nothing to do with stage. It's always kind of a confusing point because you see all those numbers and it's a completely new language for you. No one is expected to know this, right? And so this is where we come in to help with understanding what this means. So it's just another sort of way of describing a breast cancer when we look at the breast cancer under the microscope. So we talked about subtypes. We talked about the grade of the cancer. And now for every subtype, there is a stage of the cancer. Stage is basically meaning it correlates to how large the cancer is in the breast, and it also involves the status of the lymph nodes under the armpit. So the bigger the size of the tumor, or the more lymph nodes that are involved under the armpit or the axillary lymph nodes, the higher the stage of the cancer. So stages are anywhere between 0 to 4. Stages 0 to stage 3 are curable, potentially curable breast cancers, which means that these are ones that are amenable to resection, to removal with surgery, and then potentially more treatments. Stage 4 breast cancer is when we are dealing with a breast cancer that has left the origin of where it started, which is in the breast, and has spread to other organs in the body. This is when we call it stage 4 breast cancer. In 2022, the answer is this is not a curable breast cancer, but it is an extremely treatable breast cancer. But the goals of our treatment become a little different, and we can talk about that. Stage 0 breast cancer is non-invasive breast cancer. What this means is something we call DCIS, or ductal carcinoma in situ. What that means is that those cancer cells that started in that duct are still confined within that duct. They haven't kind of broken through and invaded into those duct, outside of that duct. And so this is what we call stage 0 breast cancer. This is in other words, a lot of people call it basically kind of like a pre-breast cancer, because again, the cells have not become more invasive. It's not an invasive breast cancer, or it's a kind of a pre-invasive breast cancer. This is typically treated with surgery and then radiation if someone has a lumpectomy, or they're what we call breast conserving surgery. And then we talk about potentially a hormone blocking pill if their DCIS is estrogen driven. And that's really to help prevent or decrease the risk of a local recurrence, but also helping decrease the risk of new estrogen driven breast cancers in the breast. Stage 1 to 3 are invasive breast cancers. And the earlier the stage, basically, the less the chance of spread. Or, sorry, can you hear my notifications? Yes. I want to make sure. Sorry about that.
You're okay. I do like that you kind of the way that you've simplified that, though. Just the grading, well, not necessarily the grading, but the different stages in, how they classify. Because oftentimes you'll think about stages and you'll have an idea in your mind about what that looks like or what that may feel like. So I really do appreciate you being able to explain that to us in such a way, but keep going.
No, of course. And sorry about my notifications. These come on my computer as well. So
yeah, mine does it too. It's cool.
Let me try to just try to silence them for you here.
Yeah, no problem.
Well, I'll try my best. I don't want to hold us up. It's okay. I do apologize for those.
You're cool.
So in terms of our, so the stages anywhere between stage 1 to 3 is basically based on the size of the tumor and the involved the lymph nodes. So the larger the size of the tumor, the more lymph nodes are involved. This is a higher. One breast cancer is one that does involve lymph nodes. Breast cancer in the breast, usually the lymph nodes are clear. Into stage 2, in breast cancer, our breast cancer can be larger and more lymph nodes can be involved. And the way that we think about spread of breast cancer is typically a more local spread. So so when we think about the spread of breast cancer, those lymph nodes are the ones that can spread from one, are the ones that basically drain all of our sort of lymphatic channels from the breast into our lymph nodes that are under the armpit. And so typically, if cancer were to spread, breast cancer were to spread, usually the first step is those lymph nodes, which is why they're very important when we talk about surgery. And part of breast cancer surgery involves those lymph nodes. And that's how we kind of stage breast cancer. It's staged by the size of the tumor, the involvement of the lymph nodes, and the organs as well.
Thank you so much, Dr. Khoury. I don't know what's going on with my connection. It's just acting a little funky, so bear with me. But I mean, you've kind of answered a lot of my questions all in that one thing, though. What are some key components to diagnosing breast cancer, the grade and the stage, and how that looks. So what are some things that go into making a decision for treatment? Like, how do we decide on if the right treatment is radiation or chemotherapy? Like, what are some things that kind of influence those decisions?
So all of these things that we talked about do influence those decisions. The type of breast cancer, the stage of the breast cancer, the grade of the breast cancer, they all weigh into deciding on that. So when we think about treatment for breast cancer, let's talk about the early stage setting first. Okay, so when we're talking about anywhere, we talked about stage 0. Stage 0 typically extremely curable, extremely good prognosis, really extremely low chance of spread with stage 0 breast cancer or DCIS because it's non-invasive. Mm-hmm. When we think about stage 1 to 3 breast cancer, we think about the type of breast cancer. When we think about the types of surgery, so let's talk about surgery in the beginning. 2 big types of surgeries that we consider for breast cancer: lumpectomy and mastectomy. Lumpectomy means removing the cancer itself with a rim of healthy tissue around it. So it's a lump and we remove that. Mastectomy is removing the whole breast. These are completely equivalent when it comes to long-term outcomes. And that's why patients usually have the option. It can feel, and we have a lot of people who come into our clinic, our interdisciplinary clinic, where they meet with me, they meet with the surgeon, they meet with the radiation oncologist that day, and deal with cancer again. And that's really kind of a misconception. And that's where we come in to help, debunk those myths and make sure that people know that your risk of this cancer recurring or this cancer, spreading is basically the same, regardless of the type of surgery that you have. Some patients may not be a candidate to preserve or conserve their breast, and we would know that. But for patients who have the option, a lumpectomy with radiation is equivalent to a mastectomy. And so we have always those options when we think about them, because this is local treatment. So local treatment means removing the cancer, removing a healthy rim of tissue around it, and that can be followed by radiation. I always use the analogy of a garden. When we think about cancer, we think about it as a systemic disease, okay? So we think that cancer is more systemic. It's maybe not be as localized as we think. So when we're treating cancer, we want to kind of treat the whole garden. Our body is the garden. If you have some bad weeds somewhere in that garden, you want to weed them out, right? So surgery does that. Surgery, you go in and you weed out the bad weeds that are there. But we all know, if you garden or know someone who does, that if there are some bad weeds somewhere there may be some bad seeds underneath the soil that you can't really see. And part of treating that soil and helping prevent more bad weeds from coming is to help treat the soil as well. And especially if you think there are sort of those dandelions and the wind blows and a lot of those, small dandelions are going to go further away from where it is. That's where radiation comes in after to kind of clean that area around where surgery was. So that's mostly where the cancer was. And then anything we do systemically, so any kind of medications we do, are not only going to treat the area where the cancer was, but they're going to treat all the soil underneath, right? They're going to treat the whole body. And this is how we think about treatment for cancer. So options for surgery, lumpectomy and mastectomy, both have the same outcomes in terms of risk of this cancer recurring. Not everyone needs a mastectomy. And a lot of people most people are usually going to be candidates for preserving their breast. That's usually followed by radiation. If someone does have a lumpectomy, most people are going to be candidates for radiation. And radiation therapy is basically a very focused beam of radiation to where the cancer was. It is not whole body radiation. And usually it's extremely well tolerated. You kind of don't see, hear, smell anything when you're going through radiation. It can feel a little bit like a sunburn. And systemic treatment sort of weighs in. Everything we do, again, after surgery is to help decrease the risk of cancer spreading. So that's when you're treating the whole body, treating any kind of cancer cells that may have not have been removed by surgery. That's what we're doing by treating with medications. So if we're dealing with a hormone-driven breast cancer, the mainstay of treatment tends to be with hormone-blocking medications. And that's to help decrease basically the production of hormones, estrogen, progesterone in our body, and helping decrease and treating breast cancer that way. If someone has both their breasts in still, that also has a second sort of goal of decreasing the risk of new estrogen-driven breast cancers from happening. Chemotherapy is also another medication, other types of medications that we use for breast cancer. Not everyone who has breast cancer needs or would benefit therapy, especially when we're thinking about hormone-driven breast cancer. So that's where the subtype of breast cancer comes in. So if someone has a hormone-driven breast cancer, depending on, again, the stage of their cancer, the age of the patient, the subtype of the breast cancer, and there are other tests that we set off, something called oncotype or mammoprint. This person benefit from chemotherapy on top of the estrogen blocking pills, Or will there not be a benefit of chemotherapy in terms of reducing the risk of cancer spread? When we are talking about HER2 positive breast cancer or triple negative breast cancer, most patients are going to benefit from the use of chemotherapy because those subtypes of breast cancer tends to be more, in a way, I don't like to use this word, but they are a little bit more aggressive subtypes. And the way that we treat them is typically with chemotherapy. For HER2 targeted or HER2 positive breast cancer, we have targeted medications toward that HER2 protein, something called Herceptin or Perjeta or both. Both of these are medications that target that HER2 protein. So they're not chemotherapy. They are what we call monoclonal antibodies. So it's kind of, I think about it like a puzzle. You know, this is the cancer cells. Those proteins are kind of like spikes on that cancer cell. That medication is going to find that protein, it's going to bind to it and kill off that cancer cell that way. So usually we use those medications, but we use them in conjunction with chemotherapy, at least for a little while. But for early stage breast cancers, there is usually, if someone does benefit from chemotherapy, that is a short course of chemotherapy. We're not talking about something for life. And even the estrogen blocking pills afterwards, you know, if someone has an estrogen-driven breast cancer, we're also not talking about a pill that is for life in the early stage setting.
Okay.
One plug here for triple negative breast cancer. We also get a lot of questions about what about immunotherapy. Immunotherapy is kind of a very new type of treatment that has been used in a lot of different cancers to help fight off cancer cells. It's not chemotherapy. It works very differently. It uses your own body's immune system to help fight off cancer cells. This didn't really have a space in breast cancer up until a few years back. We're talking probably about 5 years back or so. Now, where we do have a space for immunotherapy, it's actually in triple negative breast cancer. In the early stage setting, we use it for more advanced stages of triple negative breast cancer, like stage 2 or 3 breast cancer, where we actually use it with chemotherapy to help shrink cancer before we go on to surgery. And we can talk a little bit about that as well if you want.
Thank you so much for just breaking this down in ways that even I can understand. I always tell people that I am not the most medically competent. So when I say break it down for people, I mean me. I am people. So one thing I would love for you to also touch on is the difference in treatment for stage 4. Like I know you mentioned, like it is very treatable, though it is the diagnosis that's not necessarily curable. Can you kind of just break down how that treatment looks different from other breast cancer stages?
Absolutely. So one thing I always tell my patients who are living with breast cancer or living with stage 4 breast cancer is we know that, unfortunately, we can't say that this is curable because we know that cancer has spread to other organs. So our goal becomes more palliative. Our goal of treatment becomes to help prolong our life with maintaining a good quality of life. Because when we're treating breast cancer, our treatments can be hard. And so our goals, and I always tell my patients about the 3 cardinal rules. First one, as long as this is working well for your cancer, so it's keeping the cancer under good control, which means good control can mean the cancer being stable wherever it is or shrinking. That is both a good control. So if this cancer is responding to the treatments that we're doing, we keep going. This is rule number 1. Rule number 2 is if you're tolerating the treatment well, we keep going. So as long as your body is tolerating the treatment well, you are able to have a good quality of life, you know, with being on treatment, then we continue. And if your body, in terms of your blood counts, in terms of your liver function, kidney function, all of that is tolerating the treatment well, we keep going. And number 3 is our patients are the captains of their ship, right? It is completely your decision if this is something that you want to proceed with. And that goes for any stage of breast cancer, right? But especially for people who are living with stage 4 breast cancer, it is completely your decision. And I always tell my patients, if at any point this becomes too much for you, or you want to take a break, or you say, you know, I'm okay not doing any treatment right now, then this is completely your decision. Because we know that this is something we may not be able to cure, but we are continuing to treat and continuing to help control the cancer and continuing to help prolong someone's life. But our goals again become, we're talking about long-term treatment, we're talking about potentially a treatment for life.
Thank you so much. I think that sometimes that part is missed for some individuals who, when they hear stage 4, you know, I'm a picture person, so like I might have a picture in mind somebody who just looks sick and all of these other different things, but that's not even always the case. You know, breast cancer does not have a look to it. Most people think that, you know, you've got to have a bald head and you've got to have cancer. Like, no, that's not always the case.
Not true.
So, yeah, it's not true.
Absolutely. And again, I always remind my patients, every cancer is different. Every breast cancer is different. Every treatment is different. Yes, some of them unfortunately do cause hair loss, but not all of them do. Mm-hmm. And, you know, our goal is for people not to feel, you know, very sick with our treatments. And it's a balance, you know, that we have to find in terms of being able to tolerate treatment and help decrease the symptom burden that the cancer in and of itself may be causing as well.
I think these types of conversations kind of help everybody get to that space. You know, I think that knowledge is power. So being able to just like talk to somebody who knows what they're talking about, and like you're doing, taking the fear factor out of it, I really appreciate it, because it can be a very difficult conversation to have when you don't know what's going on. And it is something that is very serious. So to be able to break down something so serious in a way that we can understand it is a wonderful way to kind of get to that place of making better decisions about what ways we want to address our health overall, not even just with breast cancer, but overall. So I really just appreciate you lending your knowledge to us, Dr. Khoury. I just had a couple more questions before you go. So one thing I wanted to ask is, I know you mentioned earlier that immunotherapy was recently introduced to the breast cancer community about 5 years ago. Is there anything else that's been introduced to the breast cancer community that you would like to share with us about how it's impacting treatment?
There are a lot of new advances. Every year we have something new, and that's the great thing about, I think, breast cancer in general, and that's mostly a lot of why I kind of went into this, is because there's always something around the corner. There's a lot of there's a lot of advocacy that goes on to help with improving our treatments as we go. Immunotherapy was a game changer for triple-negative breast cancer, and I think we are all excited about it. It is one that is, definitely tolerable. It is one that has rare side effects that can be serious, not as common as chemotherapy side effects, which I think is always a great thing. We're looking at improving, tolerance of treatments. We do have kind of a new class of medications called antibody drug conjugates. I like to call them smart bombs. So what they are is they're kind of just like, those antibodies, that spike and that, target that you see them. So they're just another form of targeted treatment. And instead of being a more systemic chemotherapy, they're actually more targeted chemotherapy agents. So with less risk of more adverse side effects. And with a better sort of target towards cancer. And these, especially this year, we have had kind of a break cancer where women who had what we call HER2 low breast cancer, which is currently considered HER2 negative, they still benefited from a medication that is typically used for HER2 positive breast cancer. So we're learning a lot more about, I am sorry about those notifications. We're learning a lot more about those treatments and about how we can actually use them, not just for one subtype of breast cancer, but many others. And most importantly as well, is these medications have been much better tolerated by our patients. So when we looked at the quality of life metrics as well for our patients who are living with stage 4 breast cancer, this medication called Enhertu was actually much better tolerated than chemotherapy in general. And these were patients who had received a lot of treatment before even, and they still had good responses. So I would say this is kind of a new era or a new generation of medications that are becoming, bigger in the spotlight now. there are a lot of targeted treatments as well when we think about genetic mutations.
Mm-hmm.
And I know we didn't really touch base a lot on genetics here, but not most breast cancer is genetic. So about 10 to 15% of breast cancer can be inherited. And sometimes the cancer itself can develop mutations. And so there are a lot of targeted medications that are now part of treatment that are not chemotherapy. They're actually more targeted treatments. And so again, a lot coming in the limelight in terms of new treatments and new, smarter treatments.
And it's so exciting. I mean, who doesn't want to hear that, we're getting so much closer to finding better ways to treat it. If we can't get rid of it just yet, at least we're on the way to finding better ways to treat it. So that's always really exciting to hear, Dr. Khoury. And I just want to thank you so much for taking this time out again, just to lay it all out for us in such a way that was so nice to hear, because I wasn't confused at any point. And that was really awesome. So thank you so much. And we can't wait to see you again in some other way.
Absolutely. Thank you all for being here.